welcome back to our show. Today we're going to be talking about acne scars. And just a reminder, I'm Dr. Kesty and I'm joined by my sister, also Dr. Kesty. So one common question we get about treating acne scars is, can we treat acne and acne scars at the same time? And the answer is definitely yes. You can use lasers to treat active acne and acne scars in the same session. So definitely, if you are starting to see some of your acne that is causing scars, go see a dermatologist as soon as possible to talk about treating both the acne and the acne scars at the same time. The only caveat to that would be if you're on Accutane, then we wouldn't be able to do some lasers on active acne and acne scars. But other than that, yes, it's common. Everybody has blemishes here and there. So most people with acne scars are going to have some active acne at the same time. Okay, so Dr. Kesty, which lasers do you love for acne scars? So I like a combination of lasers for acne scars. It really depends on the patient's skin type, how deep and how severe the acne scars are, and then also what their downtime is. I'd say for patients that are good candidates for ablative laser, you can use both CO2 and erbium on them. And that's going to be your workhorse for the deeper acne scars and just resurfacing in general. And you could do both of those fully ablative or fractional, or combination of fully ablative and fractional. Your other ones that are going to be really nice for acne scars are going to be 1550, which is your deep fractionated collagen stimulating laser. If there's a little bit of pigment with the acne scars, like some hyperpigmentation, 1527 is a great laser to pull into that. For patients who don't have any downtime, 1064 is a great option. It's just kind of going to be your 1064 photofacial. That will over time build collagen for patients to treat some acne scars. Lastly, the two lasers that I'd pull in for patients with acne scars would be a 532 vascular laser if they have some redness, or a BBL or an IPL to treat kind of some active acne or some rosacea or the redness with acne scars. So a lot of lasers can help with acne scars for sure. It's just kind of finding that custom combination for that patient. Yeah, exactly. Acne scars aren't just, all comers. So, some of them are deeper, some of them are more superficial, some of them are red, some of them are dark. So that's why we kind of went over a breadth of lasers, is because there's a breadth of problems that can come with acne scars for sure. What about active acne? How do you treat that? So active acne, my two favorite lasers would be treating it with a 532 laser, a vascular laser. You can use kind of acne rosacea settings with that laser. That's going to be a really great acne laser. And then also using the 420 and the 560 filters on the BBL or the IPL that kind of target that P. acnes bacteria, and then also target some of the inflammation in the individual, like comedones or pustules. So that combination, sometimes I'll do some extractions or some milia removal, and then also maybe pull and appeal, depending on the patient's skin and their downtime. So yeah, definitely agree with that for sure. So Dr. Kesty, can you treat acne scars in all Fitzpatrick skin types? Yes, here at St. Peter's for Skin and Laser, we see all skin types from very light to very dark. And thankfully, we have a really good breadth of lasers that can be applied to acne scars in all of those skin types. So, in general, if you're talking about a lighter skin tone, you can go more intensive as far as fully ablative, meaning treating the whole top layer of the skin. Whereas a darker skin type, you want to treat just a fraction of the skin, but you can actually increase the depth of where that laser is going. So it depends on kind of what the patient is coming in for, but definitely all skin types we can treat. When you see a patient with acne scars and you're going to do laser on them, is there a lot of downtime involved? What can they expect during the recovery? It doesn't have to be a lot of downtime. Ideally, even with some of my deeper fractionated lasers, I would love a week of downtime, because then I think we can get some really stunning results. But I have a lot of patients who come in and say, hey, I really need help with this, but I do commercials or real estate, or I have work tomorrow. All those things can be customizable. So yes, it's possible. Ideally, I would say, a week would be a good time frame as far as kind of downtime after a laser. That includes slight bleeding, slight oozing, slight swelling after the fact. So it's more like social downtime as opposed to true downtime where you're in bed recovering. Correct. You can definitely go out and about and do your normal activities. It's just your comfort level as far as maybe having some evidence that you had laser done. So, a lot of my patients want 100% clear skin and 100% recovery from their acne scars. Is that realistic in your experience? You can definitely have a 95% improvement in acne scars, but it's going to take a lot of laser sessions. It's not one, it's not two, it's not even three laser sessions to get that high of a percentage, just like other scars. The depth of the scar, how old it is, kind of other factors, how healthy you are, is going to determine how many laser sessions you need to get X amount of improvement. And there's no diminishing returns with lasers. Every time you do a laser session, you're getting improvement, improvement, improvement. So definitely possible, but not going to be kind of one, two, or three laser sessions. Yeah, in general, I usually tell my patients 4 to 6 sessions, a good goal for us would be a 70% improvement. So that's kind of realistic what you're looking at as far as no matter the technology that we're going to apply that day, which obviously we mix that around just to kind of increase that efficacy. But that's a realistic expectation is, 70% improvement in somewhere in the 4 to 6 session range. Yeah, for sure. And that's with everything else that we do too, TCA cross, subcision, PRP serum, kind of that's throwing the kitchen sink at patients to get that stellar result. So can you tell me more about those things that we do? Because we do a lot for our patients here. And, I'm sure patients are interested in, not just lasers. We do a combination of everything. So what are some of those things that you like to do? Yeah, for sure. So when we see a patient for a new kind of acne scar laser consult, first of all, if you do have active acne, we're going to talk about how to treat it. We have to stop the scars from forming. So is that orals? Is it topicals? Is it a skincare regimen? Whatever. That's kind of our step number one if you have any evidence of any active blemishes or active acne. And then in terms of when we do the lasers, which we talked about is a custom set of lasers for each patient, we're also adding on a couple things. So the first thing would be TCA cross, which is where we take a really, really strong peel solution. That'd be too strong to do on your full face. So we take a little toothpick and we dip it in the peel solution, and then we carefully and precisely put it in the bottom of the scar, right at the bottom of the scar, just to build collagen locally to kind of help that scar pop up a little bit. So usually we'll do that kind of before any lasers. The TCA cross is usually for those like kind of rolling scars as far as kind of they have either small little pits or just the kind of when you run your hand over your skin that you can notice some kind of indentations. Those are when we use, and in the indent, which is what Dr. Kesty was saying, is that's where we put that TCA cross again, because it reaches some of that deeper collagen to kind of push that indent up over time. Yeah, exactly. So we love the TCA cross. The other thing would be subcision, which is where we take either PRP or saline and we kind of break those deep tethers in the same type of scar where, it has some depth to it. There are some kind of fascial tethers which kind of keep that depth of the scar tethered to the deeper fascial layer. So we do subcision to kind of break that tether so it can kind of lift up over time. So, and that's something that I prefer to do with PRP as opposed to saline, just because instead of adding that saline in, you're adding kind of the patient's own growth factors and stem cells right in. So you do get a better result. So that would be subcision. And then PRP, which we've talked about before, taking a small tube of your blood, spinning it down in the centrifuge, shaking out those stem cells and growth factors. So we use it in 3 ways for our acne scar patients. We use it as our liquid for subcision. We use it post-laser. We drizzle it all over the face to kind of build the maximum amount of collagen from each laser session. And then we also give it to you in a serum to take home to use 5 to 10 times per day as you're healing to help you heal faster, help with any swelling, help with the whole healing process, and then also to build more collagen from the laser than you would if you didn't have that PRP serum applying again and again and again over the next few days as you heal. We're really just using all of these to basically target as much controlled collagen damage and then re-stimulation and regrowth that we can. And that seems to be the most successful for patients. So Again, if you're thinking about the TCA cross is from the top, the subcision is from the bottom, the laser's all around. The maximum results is really what we're looking for the patients. And so that's kind of why we use all these modalities in conjunction to get those. Thank you so much for joining us today while we were talking about treating acne scars with lasers and a bunch of other modalities. If you have any questions, feel free to send us a DM or put a comment on this episode. And thank you so much. Thanks again.